say hi and see who I've got here. We're ready to start. Well, ladies and gentlemen, let me welcome you to the Gold Room here as we make kind of an announcement as well as do the ceremonial signings of some very important pieces of legislation that were passed this past legislative session. And I'm honored to be here to be a part of that, and certainly want to recognize some of the bill's sponsors that we have here with us. Senator Pat Jones, Representative Trish Beck, Representative Brad Daw. We had others that participated, are not here, that at least I've seen, Senator Kurt Bramble and Senator Pete Knudsen, Representative Paul Ray, and Representative Rhonda Menlove. So, but they're all part of the team and part of what made this happen in the legislature this session, so we thank them. We also want to recognize Salt Lake City Police Chief Chris Burbank, who's here with us, who's the chairman of the Utah Pharmaceutical Drug Crime Project, and we have members of that group here with us also, and we welcome them all. Also want to recognize the SMART Coalition of Utah County, which has worked very diligently to increase public awareness and on this particular issue that we're going to talk about here in just a minute, and includes the community task forces and the coalitions that have been involved in that organization. So we appreciate these are the movers and shakers that made this happen. Now, the issue at hand to us today is prescription drug abuse, which is a major problem here in Utah. It's something that everybody's aware of. It's something that we probably have shunned and not been as forthright in addressing in times past, but that is no longer the case. Prescription drug abuse is a major problem in Utah, and we're going to do something about it. In 2009, prescription drugs and the abuse of prescription drugs passed cocaine and crack as the fourth highest illicit drug of choice here in the state of Utah. And those top drugs of choice are alcohol, methamphetamines, marijuana, heroin, and now prescription drugs, and then after that, now cocaine and crack. This problem isn't going away. As much as we'd like to believe it wasn't here, was not impacting individuals and families, it is a major issue. And our Utah Department of Health today is going to release new data this afternoon showing that prescription drug overdose, the deaths caused by that, is increased in 2009. Right now, this last year, we had 310 Utahns that died because of prescription drug overdose. That now surpasses the deaths that come in automobile fatalities and car crashes throughout our state. So 310, larger than what we have that dies on the highway and automobile crash. Utah has a significant prescription drug abuse problem that must be addressed, we believe, in a multidisciplinary and a coordinated statewide effort. And our approach is for us to work together. You've heard the phrase we've used before, unprecedented partnerships, meaning that we all must come together for the good of the whole. And we're going to address it in a threefold way. Those three approaches are to, one, reduce the availability for abuse. Two, to increase the perception of risk. People need to understand that there is a physical, there's a psychological harm that occurs with drug abuse, and there's the legal problems that can impact families and individuals in significant ways. And thirdly, we want to change the public's attitude from one that's been a little bit too tolerant, in my view, in the abuse of prescription drugs, to one that is very much less tolerant on the non-medical use of pharmaceutical drugs. So again, I want to just offer a special thank you to those who've been involved in this effort. Particularly, we've had many families who've gone through the difficult challenge of having this abuse occur within their own family ranks, and the devastation and the harm that it causes to not only the individual themselves, but to those surrounding them, the families. The social impact is significant and hard to repair. We appreciate those who have overdosed and have come forward and are on the pathway to recovery, who've been willing to step out of the shadows and help us become aware of their own particular story so that we can learn and understand and then help, hopefully, find a corrective path forward. And I say to them, their willingness to step forward has been not without courage and not without difficulty, but is one that's certainly been appreciated by all those up here that have come up with these pieces of legislation to help us all. I want to say thanks to everyone today for promoting and for supporting legislations designed to address the abuse of prescription drugs, and are working to identify and to implement community and evidence-based solutions. Again, we're not tilting at windmills here today. We're in fact trying to find real solutions to real problems. These bills that are signed today here are signal key steps towards progress in this effort in combating the problem of prescription drug abuse in the state of Utah. And we thank all those who are involved in this for doing this. Thank particularly the legislators for leading the way in creating legislation that's been supported by the members of their body and that I've been able to sign into law.